water laying in the cornfields.
Wet fields mean delays in getting heavy equipment in and a lot of weeds. Nick says still expected to harvest the wheat on time. Congresswoman Amelia Sykes is resubmitting 15 projects from the 13th District for consideration in the fiscal year 2026 appropriations bill. 3 of them are Stark County projects. They include the $2.8 million for the Cleveland Avenue Northwest Streetscape project, also the $2.2 million worth of improvements to Reservoir Park in Massillon. I'm Pam Cook.
Now, your local weather forecast. Stick with us. News Talk 1480 WHBC.
Here's your AccuWeather forecast. Today, partly sunny, pleasant, and warmer with a high of 84. Tonight, partly cloudy and humid, low of 66. Tomorrow, warm and humid with sun and clouds, high of 89. Sunday, sunny, hot and humid, high of 94. Monday, hot with brilliant sunshine, high of 95. Start of an extended heat wave. Remember to stay cool and hydrated. With the AccuWeather forecast, I'm meteorologist Joe Lundberg for News Talk 1480 WHBC.
The following program is sponsored by the Medicine Center Pharmacies. You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now, here's your host, Paul White.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I am your pharmacist, Paul White. We're glad you joined us. Before we begin, I'd like to thank our sponsor, Altman Health Systems. Today, Brad and I are broadcasting from our administrative offices, and our special guest is Dr. Devillier of Altman Alliance Family Medicine. Good morning, doctor, and welcome to the show.
Morning. How are you, gentlemen?
Doing fine today.
Very good. Very good. Altman Alliance Family Medicine of AOH has 4 physicians, 3 certified physician assistants, 2 certified nurse practitioners. The group has more than 40 years of combined experience, and Dr. Devillier is with us today to answer numerous medical concerns for men. So let's get started. But before we do, I'd like to remind our listeners that today's program is also available on our podcast. Just look for Health Matters with the Medicine Center Pharmacy in your favorite podcast app, and please subscribe to our program.
Okay. Welcome again to the show, Dr. Devillier. I believe you were on with us about a year ago, and we remember you very well. So please tell our listeners about yourself and your role with Altman Alliance Family Practice AOH.
Yes, sir. So as stated earlier, I am one of the 4 physicians that are here, and 9 total of us are providers providing care for the Alliance area. I specialize in internal medicine, which is the care of adults from the age of 16 on upward throughout the lifespan. And I've got a background particularly in more critical care issues as well as outpatient care issues. So complex cases are always welcome.
Why is it important for men to get an annual wellness exam?
So it is especially important for men to get that annual wellness so that we can not only keep track of how things are going, but identify potential new issues that the patient may not even recognize or realize because they have no symptoms of anything.
So at what age should men start being seen by a doctor for an annual exam?
There's no time like the present. If you don't have a current primary provider, I would recommend that any man seek to find one. But ideally, we never really stop seeing a primary provider. Even after you finish with the pediatrician and you're a child, I'd say get on that as soon as possible, because you should be seen at least once a year so that we can check all of the routine things and head off a problem and be proactive rather than reactive.
Can you comment on how important it is for any patient to have a regular physician or provider that you can get a relationship with rather than just visiting urgent cares randomly whenever you have a problem that's acute?
So that's one of the more important issues that we face, is that patients will often not find a primary provider, and so they're getting care which can be disjointed. if you go to an urgent care here and there, you may not ever see the same provider more than once. And if their health systems don't communicate with each other, one provider doesn't know what another has done to treat you, or one provider sees one thing, another provider sees a different thing, and all these conflicting opinions may end up to more confusion and delays of care.
Well, I appreciate that because we often see patients that roll in the pharmacy, and I'm like, well, who's your primary doctor? Well, I don't have one. And so that creates another discussion, but I think it's important. So I'm glad you commented on that. So let's talk about the best screenings that a man could have for an annual wellness exam.
So that's going to change depending on the phase in life that we're in. I'd say anyone from early 16 years old to early 20s should have a good mental health screening, and should be screened by having their blood pressure checked to make sure that hypertension is not developing. Now, if they do have a family history of high cholesterol that they know of, then that's where a yearly cholesterol panel comes into play. And then as we start to get into our mid 20s all the way to mid 40s, it's important to have that yearly cholesterol panel checked. It's important to have that blood pressure checked on a regular basis, because we can start to see a trend of, okay, blood pressure was pretty normal last year, but this year it's creeping up. Is there something that maybe changed in the lifestyle? Is there something that's maybe changing within the patient physiologically, that lifestyle modification, or maybe you just need a little medication? Could be it's a family history of high blood pressure, you're exercising, you're healthy, but all of a sudden now you're developing high blood pressure, because sometimes we just can't outrun genetics. And then as we start to get into our mid 40s, it's important to do colon cancer screening. That is one of the biggest things that I see most patients are hesitant about, is colon cancer screening. It doesn't always involve colonoscopy these days. If there's no family history of colon cancer, we have a Cologuard test, which is a fantastic way and an easier method to get colon cancer screening, essentially from home with the order of a physician or a doctor. And then as we get into our 50s, starting to screen for prostate issues is another thing that becomes very important. And that'll continue on until late 70s, early 80s.
Anything else, routine appointments or something that you want to make sure men think about? I know men think we're tough. We think we're tough and we're invincible. We're not. So, what other things should we look out for?
That's one of the more common things that we see is, as men, we don't like to admit that there's a problem. We just kind of ignore it until it becomes debilitating, or until a wife or a girlfriend says, hey, you've got to see a doctor. I've made you an appointment. But it's good as a man to develop a relationship with a physician that you feel comfortable talking to on a one-to-one level, and develop a good doctor-patient relationship. A good doctor-patient relationship should almost feel like friends or a mentor, and not like someone just talking down to you, someone just handing out orders. It should be a good mutual investment in each other, that you know the doctor is looking out for your best interest and is willing to cater care to your lifestyle. And that will create the best outcomes ultimately.
Interesting.
Any
So,
common health? I'm sorry. Well, I just
go ahead.
wanted to touch on any common health problems faced by men that you see on a daily basis.
The most common healthcare problems faced by men that we see on a routine basis are elevated blood pressure, elevated cholesterol, and diabetes. And most people don't recognize the starting signs and symptoms of these, which can often be quite silent. And that leads to these problems, especially in men that don't routinely see a physician. So they don't have that routine screening to kind of head off the process.
So, heart disease is one of the leading causes of death amongst men. What can men watch out for, and are there any lifestyle changes that can help?
Well, I'm glad you brought that up, because one of the leading causes being heart disease is first seen in high blood pressure. High blood pressure is we often call a silent killer because most of the time the first symptoms are not recognized. And it could be as simple as I'm starting to get headaches much more often, or maybe my vision isn't as good as it was and it becomes blurry from time to time. Most guys will chalk that up as, okay, I'm just getting older. My vision gets blurry occasionally. I get a headache occasionally, but what it is it's those are times when the blood pressure is starting to become uncontrolled and get into a high range that could ultimately be dangerous.
How common is it that if your parent had blood pressure or glucose or whatever, how common is it that it passed on to you?
So it's very common to see it passed on. It's not a guarantee, but more likely than not, if multiple family members are struggling with a blood pressure, cholesterol, or sugar issue in terms of diabetes, that it puts you in a much more susceptible place. So if mom and dad both had high blood pressure and you're not really watching your diet, consuming a bunch of salt, or put on a bunch of weight, it's much more likely that you will start to develop high blood pressure issues, especially at an early age. And then same goes with sugar. So if mom and dad or grandma and grandpa had diabetes and you quit watching the diet, quit exercising, and start eating more carbohydrate rich foods like pastas, breads, rice, all the good things we love, it's much more likely that you will fall into that diabetic range much quicker than someone who has no family history of this.
Very interesting. I have exactly the same ailments that my father had. I don't know why he wanted to pass it on to me. Okay. Hey, it's time for our first break. You're listening to Health Matters with the Medicine Center Pharmacy.
Are you tired of paying hundreds of dollars to find out your thyroid, A1C, cholesterol, and vitamin levels? You don't have to anymore. Schedule your low-cost lab test at the Medicine Center Pharmacy. You can get your A1C, thyroid, and vitamin D lipid profile, which includes your cholesterol levels as well as glucose results. Test results in just minutes, and you can share them with your provider. Call the pharmacy or schedule online at midshoprx.com. Medicine Center Pharmacy with locations in Canton, Louisville, Minerva, and New Philadelphia. Saving money is awesome. Saving money on items you actually use? Fantastic. Hi, Paul White for the Half Off and Out by store in Louisville. If you think you'll find the same low prices, huge variety, or great customer service at any other store, you'd be wrong. Stop into our store in Louisville and see what great deals we have. Follow us on our Facebook page at Half Off Store to see super specials. Why pay full price? Come in and experience the Half Off and Out by store in Louisville, next to the Medicine Center Pharmacy. Medicine Center Pharmacies are now offering a service to help support your medication needs. We want to make sure that you have the medications you need when you need them. We will contact you 5 to 7 days in advance of your next medication refill to start the process each month. We will review your medications with you. We will contact your physician to initiate the process for refills and schedule a convenient day for pickup or home delivery. We simplify medication pickup into fewer pickups each month at the Medicine Center Pharmacies in Canton, Louisville, Minerva, and New Philadelphia. Saving money is awesome. Saving money on items you actually use? Fantastic. Hi, Paul White for the Half Off and Out by store in Louisville. Do you think you'll find the same low prices, huge variety, or great customer service at any other store? You'd be wrong. Stop into our store in Louisville and see what great deals we have. Follow us on our Facebook page at Half Off Store to see super specials. Why pay full price? Come in and experience the Half Off and Out by store in Louisville, next to the Medicine Center Pharmacy. Have you ever gone to the pharmacy and decided not to fill a prescription because of the price? This is pharmacist Paul White. If you have skipped filling a prescription or a dose because of the price, we have great news for you. We are introducing a new membership program with wholesale pricing on every generic medication. Memberships are $5 a month. For many of our customers, our wholesale pricing is even less than their copay. Visit our website, midshoprx.com, and use our price checker to find out the price of your medication. Great deals at Medicine Center Pharmacy.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now, here's your host, Paul White.
Welcome back to Health Matters with the Medicine Center Pharmacy. Are you ready for vaccine season? Stop in or schedule your pneumonia, Tdap, or shingles vaccine online at medshoprx.com. So, doctor, what is high cholesterol and how does it affect men? What are the early signs, if any?
So that's a good question. Most of the time, there are no early signs of high cholesterol that most people would recognize. And usually, by the time we start seeing high cholesterol, it's quite high and it starts to develop physical signs and symptoms where you can see a opaque white colored ring around the colored portion of your eye.
Hmm.
But what high cholesterol is sometimes genetic. It's a combination of lifestyle factors in terms of what we eat and what we process through our body, but also can be a genetic influence thing where your body is just more likely to produce these high levels of cholesterol, and something unfortunately that you can't always correct from a lifestyle change without medication. And that's why it's important to see a physician about this. We can screen for cholesterol. We can see, okay, you're living a healthy lifestyle. You're doing everything you should. You're eating a healthy diet. You're exercising. But for some reason, your cholesterol is very elevated. And so we'll start to poke and prod into that more. And turns out your father had high cholesterol, your mother had a stroke, your grandfather had a heart
Mm.
attack, things like that. And it lets us know that, okay, from an early age, we're not going to be able to correct this cholesterol issue just with diet and exercise. We have to get started on a medication. And that's where a good relationship with a primary care physician and a good relationship with a pharmacist is always important because there are side effects to any medication, and you may see your pharmacist more often than you're seeing your doctor because you're having to go pick up those medications. And during the routine counseling, your pharmacist can often catch things that they tell you, hey, you should see your doctor about this.
Okay, so what is hypertension and what are the early signs, if any?
So, hypertension is one of those things that goes along with heart disease. It's just an elevated blood pressure above what we expect to be the normal blood pressure. And first signs and symptoms that most patients will recognize are going to be more frequent headaches. Sometimes you can get lightheaded and dizzy. They'll see abrupt blurring of the vision. Those are usually first signs of high blood pressure. There are also other things that some people notice where they say they can hear a throbbing in their ears because we have blood vessels that run very close to the ears. Um, so things like that are very subtle and we don't always notice it, but it is important to recognize this could be the sign of something going wrong if it's happening on a consistent basis.
My first situation or deal with blood pressure, high blood pressure, my college roommate showed up one day with a red face. And I said, Hey, I said, what is the matter with you? He said, Well, I've had blood pressure for quite some time in my life, and I just got back from the doctor, and he prescribed some medicine for me to take for the blood pressure.
That can also be one of the things that some people notice. It's not something that everyone's going to develop. Some people just have a more prone complexion to get flushed and red in the face. But if you're noticing someone who doesn't normally get flushed and get red in the face suddenly start to develop that on a more consistent basis, it's just higher blood pressure flowing through
Hmm.
the smaller blood vessels that are supplying blood to the skin. And that's something that should be looked into.
Okay, Brian.
Okay. So, what can men do to reduce their risk of heart disease?
So, the number one factor to reducing the risk of heart disease is knowing your family history. Knowing your family history helps to head off if you know you, and most people who have a strong family history of heart disease will know it. They'll say, oh, well, dad and mom had an issue with their heart. They developed a heart attack, stroke, they developed heart failure, or My brother or sister, as we start to get into adulthood, has developed this at an early age. So that's one of the things that people at very high risk will notice. People at a medium to lower risk may not know their family history nearly as well. Or if it was a case where you were adopted and don't know your family history as well, that's where meeting with a primary doctor on a year-to-year basis is a good thing, because we check the cholesterol to see, well, did it go from normal to very elevated in a short period of time? We check the blood pressure. Did it go from normal to elevated in a very short period of time? And lifestyle modifications are the biggest thing to help change that risk factor, because you can reduce the risk of heart disease in yourself by eating a healthy diet and maintaining a good exercise regimen of at least 30 to 45 minutes of moderate intensity exercise, at least 5 times a week.
So that kind of leads me into the next question. We still have a lot of challenges in our country with being overweight and obesity. What are some different treatment options available for patients suffering from obesity?
So there are many commercial options out there. Honestly, my first recommendation for anyone is going to be diet and exercise. It's going to be the most cost effective. Now, will it work for everyone? Not necessarily. Some people have debilitating ailments where they're not able to get the exercise that they should be able to because of arthritis or because of nerve issues like sciatic back pain. In those cases, I'd say do what you can, but try and combine diet with that, because diet is going to be one of the biggest things to help to maintain a healthy lifestyle, a healthy exercise regimen, a healthy weight. But we do have commercial options that have become very popular lately, such as Mounjaro, Wegovy, Ozempic, Rybelsus. Those options are good options, especially if your insurance will cover it. Now, I wouldn't say to do that alone. I'd say combine it with diet and exercise, because the last thing you want to do is just take a medication to improve weight without actually doing some level of physical activity and without modifying your diet. Because if it comes to the point where you're no longer able to take the medication, or you're no longer able to get a hold of the medication, and you haven't changed those diet and lifestyle choices, you can bounce back and be right back in the same situation you were in before you were on the medication. And you don't want to lose muscle mass as you go on, because one thing, unfortunately, none of us can change is time. We're all aging, and the normal aging process, we reduce muscle and increase fat. It's just an unfortunate part of the human condition. And so the best way to modify that is to try and increase muscle so that you're not losing the muscle and replacing it with fatty tissue.
We've been pretty heavily invested in some weight loss programs in the pharmacy, as you can imagine. And, many people call us with asking for solutions. And I'm not going to repeat the brand names of what you just said so I don't get, slandered or anything here. But many of those prices are out of reach for patients when they're more than $1,000 a month. But we've been able to use, you mentioned Rybelsus. We actually prepare a weight loss product using Rybelsus for a sublingual semaglutide weight loss product that you use daily under the tongue. And we've had patients that have had really good luck when they combine it with diet, exercise, and lifestyle modifications, and it's much more affordable. So there are some other options other than always getting a needle. So just something to think about. If you have questions, people can call us and talk to us, but you do need a prescription. You have to be under medical care, and it's a tool. It is not a total solution. You need to combine it with healthy lifestyle changes. So
Correct. And that's what I emphasize to my patients is what I've got for you are tools into a toolbox. I don't have a magic pill. I don't have a magic
yeah.
solution. Unfortunately, nothing in life that comes easy is as good as it seems. Not all that glitters is gold. So the mainstay of it is going to be a diet change. And I tell patients, don't do it all at once. Do this slowly, because slow and steady will win this race ultimately. And that's one of the best things as a man that you can do for yourself is making a healthy dietary change first, because you're going to improve weight. You're going to improve your cardiovascular risks. You can eat a lot of foods that are anti-inflammatory that help to improve prostate issues. You can help to improve testosterone issues, because as men, as we start to put on weight, we actually start to produce more peripheral estrogens, and it kind of blocks out our testosterone levels. And then once you've got your diet improved to where it doesn't feel like a diet and it's just what you're normally eating, you can start to improve exercise, because that will help to naturally boost testosterone. It'll get the blood pressure down because it'll help with weight loss. And cardiovascular exercise is great to help loosen those tighter blood vessels up, because it gets them used to expanding and contracting. And so it keeps those pliable.
Okay. One more thing about blood pressure. I have heard that as you age, if your blood pressure rises a little bit, so what's the best blood pressure? 120 over 80 or something wrong in that area? What if it goes up to 150? Okay.
So ideally, we like the blood pressure, and this is not everyone's going to have this blood pressure. We'd love for a blood pressure of 120 over 70.
Yeah.
That is textbook perfect, but everybody is different. So some people may run a bit lower, and that's their normal. We'll see this in younger individuals, especially younger men who are physically active. Their heart rates and blood pressures may run a bit lower than we expect, but that is their normal because they're cardiovascularly fit. We allow for some what we call permissive hypertension, which means instead of 120 over 70, we may bump it to 130 over 80 as perfect for older individuals who have multiple issues and who may get dizzy, lightheaded, and have episodes of passing out if their blood pressures are at that 120 over 70 or lower. So we allow like a 130 over 80. But if you're consistently getting blood pressures around 150 over 80 or higher, that's becoming an issue. And that puts you at higher risk for things like heart disease and strokes, heart attacks, heart failure. You should definitely talk to a primary care physician about this, because you may need medications.
Okay. Isn't it time for our second break?
Yep.
Okay. All right. It is the bottom of the hour and time for the news. Thanks for joining us this morning on Health Matters with the Medicine Center Pharmacy.
WHBC AM 10, reliable as ever on News Talk 1480 WHBC.
From the News Talk 1480 WHBC Newsroom, Ohio Attorney General Dave Yost has given approval for the sale of Summa Health, the for-profit company Hatco. Officials say it'll help the Akron-based Summa Health clear $850 million in debt. The company says Summa's employees, providers, and leadership team will stay on board during the transition. Yost called the agreement a step that could strengthen health care across Northeast Ohio for years to come. Charges have been filed after the death of a missing Warren man, 28-year-old Nathaniel Crockett, now charged with murder and felonious assault, one count of kidnapping, and additional related offenses. Javar King was first reported missing from Warren back in February, but in March, King's body was discovered near an abandoned home with a gunshot wound to the head. President Donald Trump skipped an official Juneteenth tribute yesterday, saying America already has, quote, too many non-working holidays, that closing businesses cost the country billions. And in sports, it is not over yet. The Pacers blew past the Thunder 108-91 in Game 6 of the NBA Finals last night, knotting that series at 3 games apiece and forcing the first final Game 7 2016 when the Cavs and Golden State Warriors were in it. Sunday night, 8 o'clock, play for the championship. Guardians couldn't get the sweep yesterday. They fell to the Giants 2-1. I'm Pam Cook.
Your severe weather station, News Talk 1480 WHBC.
Here's your AccuWeather forecast. Today, partly sunny, pleasant, and warmer with a high of 84. Tonight, partly cloudy and humid, low of 66. Tomorrow, warm and humid with sun and clouds, high of 89. Sunday, sunny, hot and humid, high of 94. Monday, hot with brilliant sunshine, high of 95. Start of an extended heat wave. Remember to stay cool and hydrated. With the AccuWeather forecast, I'm meteorologist Joe Lundberg for News Talk 1480 WHBC.
Saving money is awesome. Saving money on items you actually use? Fantastic. Hi, Paul White for the Half Off on Out By store in Louisville. Do you think you'll find the same low prices, huge variety, or great customer service at any other store? You'd be wrong. Stop into our store in Louisville and see what great deals we have. Follow us on our Facebook page at Half Off Store to see super specials. Why pay full price? Come in and experience the Half Off on Out By store in Louisville, next to the Medicine Center Pharmacy. Medicine Center pharmacies are now offering a service to help support your medication needs. We want to make sure that you have the medications you need when you need them. We will contact you 5 to 7 days in advance of your next medication refill to start the process each month. We will review your medications with you. We will contact your physician to initiate the process for refills and schedule a convenient day for pickup or home delivery. We simplify medication pickup into fewer pickups each month at the Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia. Have you ever gone to the pharmacy and decided not to fill a prescription because of the price? This is pharmacist Paul White. If you have skipped filling a prescription or a dose because of the price, we have great news for you. We are introducing a new membership program with wholesale pricing on every generic medication. Memberships are $5 a month. For many of our customers, our wholesale pricing is even less than their copay. Visit our website, midshoprx.com, and use our price checker to find out the price of your medication. Great deals at Medicine Center Pharmacy. Are you frustrated with the cost of prescription drugs? By now you know that your insurance price isn't always the best price on your medication. The new Health Matters Drug Savings Plan is simple. Easy way to save money at your local Medicine Center Pharmacy. No need to visit a website or disclose your private information, fumble with your smartphone, or print out coupons. Just talk to one of our friendly staff members and ask for the best price. Medicine Center Pharmacy with locations in Canton, Louisville, Minerva, and New Philadelphia, and online at midshoprx.com. Saving money is awesome. Saving money on items you actually use? Fantastic. Hi, Paul White for the Half Off on Out By store in Louisville. Do you think you'll find the same low prices, huge variety, or great customer service at any other store? You'd be wrong. Stop into our store in Louisville and see what great deals we have. Follow us on our Facebook page at Half Off Store to see super specials. Why pay full price? Come in and experience the Half Off on Out By store in Louisville, next to the Medicine Center Pharmacy.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now, here's your host, Paul White.
You are listening to Health Matters with the Medicine Center Pharmacy. I am your host and pharmacist, Paul White. This morning we are talking to Dr. Devillier.
All right, doctor, we talked about a lot so far. Why don't we talk a little bit about the common signs of prostate problems?
Yes, so that is one of the things that most men will see from time to time throughout their life, usually in the older years, and most people don't recognize it immediately as a prostate issue. And it may be the first sign you really notice is having to strain to start a stream of urine, or most men will say, well, now it takes a little time to concentrate on getting a stream of urine started. Other signs and symptoms we can commonly see are that you finish urinating but need to go again real soon after. We'll notice things like that where the bladder doesn't completely empty. And some men have it where it hits them more at nighttime and they're having to wake up 4, 5, 6 times a night to urinate, and they're only able to urinate a very small amount, but it feels like there's possibly still urine in there. And what happens is the prostate actually inflames and swells around the urethra.
So, what is GERD and how can it affect men?
So, in a different topic, GERD is the medical terminology we use for acid reflux as a general term that the most of the public would know. And it doesn't always involve that classic kind of burning, burping sensation through the chest. It's scary because the nerves that connect to the stomach pass right behind the heart. So some people describe it as a chest pain that's aching, which scares them into thinking they have a heart attack. Other people have more benign symptoms that get mistaken for asthma, where they have a lot of coughing, and some people have coughing with a bunch of mucus production. Especially if that coughing is late at night, first thing in the morning, that could be a indication that it's more of an acid reflux issue. Um, Another symptom that we notice is like a metallic taste in the mouth, especially early in the mornings. And what's happening is a lot of the times we're eating too late at night. And so our body is trying to digest food as we are trying to relax. So your stomach is producing the acid and churning it around to try and digest food. But when we lay down in bed to relax and the muscles start to relax in the throat, you allow that acid that is built up in the stomach to reflux back up into the esophagus.
Yeah, I can't eat late any night, anymore. I just
Exactly.
so many people at 10 o'clock are eating dinner, and I'm thinking, oh my gosh, what are you people doing? And it's pizza or it's highly seasoned spaghetti or something like that. And I'm thinking, oh my gosh,
Exactly.
how can you handle that?
As
Okay.
good and as good as Italian food is, it's pretty
Uh,
notorious for causing acid reflux because we've got the oils, we've got the cheeses, we've got the fats and carbohydrates that are primarily broken down by stomach acid. And so eating larger quantities of those types of foods will cause more stomach acid to start with.
yeah, for sure. So, how about testosterone deficiency? How does that affect men? What are the early signs of that?
So testosterone deficiency, we're seeing more and more men recognizing signs and symptoms of something may be off with the testosterone. Often the first thing that men will complain about, but not realize the testosterone deficiency or a warning of testosterone deficiency, is decreased exercise tolerance and fatigue. Now, it doesn't always indicate testosterone deficiency, which is why you should see a primary care doctor. Because if you're having increased daytime fatigue and not able to exercise or tolerate the amount of activity that you were, it's not simply aging. We see most men will chalk that up and say, oh, I'm just getting older. I can't go like I was when I was younger. I can't, I'm more tired during the daytime. I need a nap. It could be testosterone deficiency. It could be sleep apnea, which is another common condition we see with men as we start to age, is especially if we're putting on weight, sleep apnea becomes a major issue. But the first sign and symptom that men really say, okay, that's a testosterone deficiency, is usually erectile dysfunction. But we notice a lot of the time, by the time we get the erectile dysfunction, we've had the decreased tolerance to exercise. And when I say decreased tolerance to exercise, maybe you work a normal 9 to 5 job, you don't really hit the gym, but you notice your job wears you out much quicker. That could be a sign that maybe you're not producing as much testosterone as your body needs.
Hmm, interesting.
I got to make a comment on that too, since we do an awful lot of compounded testosterone for men topically. I don't think we men get enough credit. That women get to hear a lot about menopause and talk about it, but there's andropause for men, so it's real. We just, maybe it's like we go back to, and we don't want to talk about these things. But don't be afraid to talk to your doctor about these things. You don't have to. And to give you some props, doctor, you're here, you're local. You don't need to go on some app and talk to some faceless doctor. Get your primary care together, get together with them and talk to your doctor so you can get that relationship going, and it'll help you pay off down the road. So there's an awful lot of things going on online where you're not going to get the care you need when you can get it here at home. Um, so now we ought to talk about diabetes. We see an awful lot of diabetes in the pharmacy too. Lots of questions about what do we do? Are men's symptoms any different from women? What should we look for?
Correct. So developing, like I said, that relationship with your pharmacist, with your doctor, is important because that allows you to tailor care to your specific needs, because we're not all cookie cutter. Not everyone requires the same care. Not everyone tolerates the same medicines. Not everyone wants and responds to things the same. So often the first things we'll see that are an indication of diabetes are increased urination, increased thirst, things like weight loss. In men, one of the first things I'll see with many patients is they'll tell me, well, I'm losing weight. I'm not trying to. I'm pretty happy with it. But I'm also having to go to the bathroom way more often than I used to. Or, I'm doing the same things I always do at this time of year. I'm following the same thing, but man, I'm a lot thirstier. I notice that I'm always feeling like I'm dried out. Those could be signs of diabetes starting.
Interesting.
All important tips. Skin cancer. We finally have some sun in Ohio. Let's talk about skin cancer and what to watch out for.
Yes, so it's a very important time to talk about that, especially with men. We tend to enjoy more outdoor activities. It's starting to get nice. We're barbecuing a lot more. We're by the pool. We're out on the rivers fishing, floating, working on the lawn. Especially in fairer complected individuals like myself, you've got to worry. You got to worry about skin cancer a lot more because sun damage tends to happen quicker and easier the more fairly complected you are. And we all know that as children, our moms used to say, well, put on sunscreen, wear a hat, things like that, because they knew that skin cancer is a risk. We tend to say, oh, well, I don't like the feeling of the greasiness of sunscreen on my skin. It's hard to wash it off. I don't want to wear a hat. It's just not my style. But those are things that are important, and things you should look for is changes to the skin where you start to develop moles, bumps, or areas of the skin where it seems like it's more fragile and fatigable. So if you have moles and you notice, okay, well, this one looks a little different, that is a time to talk to your doctor and say, hey, can you take a look at this? Maybe the mole is darker. Maybe it looks more irregular and everything else looks pretty regular. Or maybe it's an area where you itched it, you scratched it, it bleeds, and it never really heals up. Those are things to look at, because if we can catch skin cancer at an earlier stage, it's much more likely that we can completely cure it by removing it. So rather than going through chemotherapy, major surgeries, it could be removed with a small surgery or a biopsy, depending on the size.
Keratosis first.
Yes, sir.
Okay. Why do you get those in just anywhere? It's just kind of strange.
Those are gonna show up more in sun exposed areas. Those are the most likely places to develop those. So we see them on a lot of men, the top of the head, because we don't wear hats often, especially if our hair is starting to get thinner in later life or it's starting to get lighter in color. You have less sun protection. We see it on the forehead, the bridge of the nose. We see it on the forearms, the shoulders, the upper back, areas that are commonly exposed to the sun. And actinic keratosis is one of those things that we need to get checked on and looked at an earlier stage, because we can often remove those and remove that individual threat of skin cancer.
Okay. Our final break is here. You're listening to Health Matters with the Medicine Center Pharmacy.
Are you frustrated with the cost of prescription drugs? By now, you know that your insurance price isn't always the best price on your medication. The new Health Matters drug plan is a simple, easy way to save money at your local medicine center pharmacy. No need to visit GoodRx or Single Care, disclose your private information, or print out coupons. Just talk to one of our friendly staff members and ask for the best price. It is that easy. Medicine Center Pharmacy with locations in Canton, Louisville, Minerva, and New Philadelphia, and online at medshoprx.com. Saving money is awesome. Saving money on items you actually use? Fantastic. Hi, Paul White for the Half Off on Out by Store in Louisville. If you think you'll find the same low prices, huge variety, or great customer service at any other store, you'd be wrong. Stop into our store in Louisville and see what great deals we have. Follow us on our Facebook page at Half Off Store to see super specials. Why pay full price? Come in and experience the Half Off on Out by Store in Louisville, next to the Medicine Center Pharmacy. Saving money is awesome. Saving money on items you actually use? Fantastic. Hi, Paul White for the Half Off on Out by Store in Louisville. If you think you'll find the same low prices, huge variety, or great customer service at any other store, you'd be wrong. Stop into our store in Louisville and see what great deals we have. Follow us on our Facebook page at Half Off Store to see super specials. Why pay full price? Come in and experience the Half Off on Out by Store in Louisville, next to the Medicine Center Pharmacy. Medicine Center pharmacies are now offering a service to help support your medication needs. We want to make sure that you have the medications you need when you need them. We will contact you 5 to 7 days in advance of your next medication refill to start the process each month. We will review your medications with you. We will contact your physician to initiate the process for refills and schedule a convenient day for pickup or home delivery. We simplify medication pickup into fewer pickups each month at the Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia. Have you ever gone to the pharmacy and decided not to fill a prescription because of the price? This is pharmacist Paul White. If you have skipped filling a prescription or a dose because of the price, we have great news for you. We are introducing a new membership program with wholesale pricing on every generic medication. Memberships are $5 a month. For many of our customers, our wholesale pricing is even less than their copay. Visit our website, midshoprx.com, and use our price checker to find out the price of your medication. Great deals at Medicine Center Pharmacy.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now, here's your host, Paul White.
So you're listening to Health Matters with the Medicine Center Pharmacy. I am your host and pharmacist, Paul White. This morning we are talking to Dr. Devillier. So,
All right, doctor, let's talk a little bit about sleep apnea, because I'm guessing that's another thing we men don't want to talk about too much.
Yes, sir. And it's one of the things that I would say is more important for us as men and anyone in general to look into, because it's connected to so many things. So sleep apnea often goes unidentified or ignored even in people who know they have sleep apnea, but it can cause many different health issues. So sleep is very important for us. It helps with emotional regulation. So if you're not getting good quality sleep, you can often end up with more anxiety and depression. It can cause fluctuations in stress hormones, causing a decrease in testosterone. It can make it very hard to control blood pressure. So you can see someone with maybe 2, 3, 4 maxed out blood pressure medications, but we can't get their blood pressure down. And often it's unrecognized sleep apnea that's causing it, because it stresses the heart out. It makes the heart more likely to have complications and to more likely develop heart disease. It can cause arrhythmias like atrial fibrillation at a later age. It can cause heart failure if untreated. So there's a whole host of issues that come with sleep apnea that oftentimes has a simple treatment.
I don't know if we handled this yet or not, but how does a man's family history put him at risk for health issues?
So a man's family history is going to put him at risk for health issues, especially if he has what we call a first degree relative with a commonly inherited problem. So a first degree relative is someone such as mother, father, brother, sister. That is someone who is a first degree relative. So it's important to look at these people closest to us. Children are also first degree relatives, because we'll notice sometimes the children will develop things before parents do. And it's things like high blood pressure, high cholesterol levels, heart disease, those things, and diabetes can be passed down generation to generation.
Those are exactly the same things that my father had.
Exactly. And it's why people come in and say, well, mom or dad had this, now my brother's got it, now I've got it. And it's important to look at in things like colon cancer as well, because there are certain genetic mutations that can happen within a family line that make colon cancer more likely to develop at a very early age. So it's important to know your family history and to just sit down and ask mom, dad, brother, sister, hey, what do you have? What are you taking medication for? Not only is it good in an emergency situation, because you don't want to give certain medication combinations if someone was unconscious and can't tell you their own medical history. It's important to know the history of those close to you, but it's important for your own health, because you may get a heads up to say, okay, my dad and older brother have high blood pressure. Maybe I should start looking at that as something I may develop and start keeping an eye on it so that I'm catching the blood pressure elevating when it's at 140 over 68 rather than catching it at 160 over 90.
Okay. What things can men do at home to improve their health?
So at home, things we have discussed so far today are look at the diet and lifestyle. So diet is first. Everything is going to connect to that. It almost doesn't matter how much you're exercising if you're working a 9 to 5 job, but you're eating fast food and you're not taking care of yourself. The diet will catch up to you eventually. Metabolism slows as the lifestyle goes on. Um, those are things we just shouldn't be putting into our body on a regular basis. It's okay to have it as a once in a while thing, but I wouldn't make it a routine part of your lifestyle. And then exercise becomes more important as we get older because, as we've discussed, you kind of want to lose muscle and put on fat is just the normal aging portion of the body. And we all learned in high school that a body in motion stays in motion. It's not just that old physics lesson, it is a lesson in life. If we don't use it, we're going to lose it. So you've got to use those muscles to stay mobile. And that's the last thing that any of us want at an older age is to lose independence because we can't get around.
It's true. What options do men have to help quit smoking?
So we have a variety of options to help men quit smoking, and that is one of the single biggest lifestyle modifications you can make if you are a smoker. We have programs that help with smoking cessation to help to consciously recognize why we're smoking. Sometimes it's for stress. Sometimes it's just out of habit. Some people say, oh, it's just routine. I've done it for years. But we do have medical options. We have options such as Wellbutrin, which can also concurrently treat anxiety and depression, but kind of decrease that urge to smoke. So if your smoking is more of a stress anxiety related thing, that may help. We also have options that the pharmacist can speak to you about, such as nicotine patches, which kind of give a steady release of nicotine throughout the day so that you're not getting those more intense flare ups of cravings. One thing that I tell people to look at is if it seems to be kind of an oral fixation that I've got patients that sometimes say, well, sometimes it's just the act of popping a cigarette in my mouth and I'll keep it unlit there for a while. Then when I get stressed, I light it up. If it's that kind of thing, there's nicotine lozenges and gum that can help with that because it's like putting a piece of gum in the mouth or even chewing on a hard candy or sucking on a hard candy. And it kind of helps with that kind of fixation. And speaking with either your doctor or your pharmacist can maybe help you to decide which method is going to be best for you because what works for one person, again, is not going to work for everyone. Some people are anxious and they'll chew the gum way too quickly, get a big hit of nicotine, and then it causes upset stomach. And in those cases, I'd say try a lozenge or a patch. Or if you're smoking more because of stress and anxiety, maybe the Wellbutrin will work better for you. And that's one of the things that I tell patients. You're seeing your pharmacist potentially every month when you go to pick up your medications. That's a good time to just talk to the pharmacist and say, hey, I'd like to stop smoking. What do you recommend? And they can tell you either we have these options or speak to your doctor about these options. See if this will work with your plan of care with your physician. And that's where building a good, comfortable relationship with both your pharmacist and your doctor is important because your doctor will communicate with your pharmacist and your pharmacist can give you things to let the doctor know, hey, I'm seeing this on a more consistent basis. And it becomes a healthcare team rather than a bunch of disjointed individuals.
I agree with you, especially with smoking too. You got to have that. You got to have the why. I mean, again, everything you just mentioned is tools in the toolbox again. But you got to have that why. So whether it's to look at your kids and make sure you're there for graduations and weddings and grandkids and stuff, or don't be too proud not to think about the future and that make some health decisions that can help improve your odds, right? So
correct. And that's the biggest thing that and I express it to my patients and us three as healthcare professionals, I think should always express to our patients, we're not here to judge you. We're not here to make a condemnation. We're here to help as much as we can. I can give you all the tools in the toolbox. I can give you all of this wealth of information, but ultimately it's going to be the patient deciding that, hey, I'd like to work as a team together that is going to improve their health. And coming to us and not having a fear of, okay, this person's going to make a preconceived notion of me because of this, that, or the other, is something that we need to overcome, especially with men, because as men, we tend to like to problem solve. We want to solve the problem ourselves. It makes us good. It makes us feel good to solve the problem ourselves, but it does not mean it's a sign of weakness to ask for help for someone else. And know that when you approach your pharmacist, when you approach your physician, you're approaching them in a they are approaching you in a non-judgmental way, and they are not here to fuss. They're not here to fight with you. They're here to help you in a way that best suits you so that it's most likely to fit your lifestyle.
So,
That was
Doctor, go ahead, Brett. Yeah.
Well, I was just going to say we're running tight on time, and that was
Yeah.
a pretty good. What do you want men to know about health before we wrap up? But is there anything else you want to touch on? We got about a minute before we got to wrap up.
The biggest thing I'd say is if you don't have a primary physician, seek one out. Find one, and it's okay to visit 2 or 3 in a row if you have to. Find the doctor whose style personally complements yours. Because if you're constantly at odds with what your doctor wants to do, then it's not going to be the therapeutic relationship you're looking for. Find a doctor that fits your personal style, because if you and your doctor are on the same page about your health, the only thing that can happen is good outcomes.
Okay, Doctor. Thank you very much, Doctor. Dr. J. Evan Devillier. If you suspect you have a medical issue, please contact your healthcare provider. Thanks to Altman Health System and our listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we'll see you again next Friday right here on News Talk 1480 WHBC. Thank you very much, Doc.
Thank you for having me.
Yeah, enjoyed
Thank
it
you
very much.
very much. Good stuff. Have yourself a wonderful day.
You as well.
Hey, it's going to
Thank
be
you.